It doesn't matter how old or young you are. We just all reach a point where our bodies are changing. So tonight we are again talking about pelvic floor pain because it often goes overlooked. And I wanted to talk specifically about pelvic floor therapy because this is not a fringe issue. It impacts 1 in 4 women. 1 in 4 women. So in continuing our series tonight, I spoke with Hinge Health. They are a healthcare group that is really focused on offering more access and getting care right into your home.
If you've ever heard these conversations of women talking and saying, "Oh, I just leaked a little when I ran, laughed, jumped, or sneezed," a third of women have that. That's urinary stress, urinary incontinence, and that's something that can be addressed. If you think about pelvic pain or even pain with intercourse, 20% of women have pain with intercourse. That's a pelvic floor disorder that's worth bringing up to your physician. Pelvic floor disorders occur when the muscles underneath the pelvis are loosened or weakened as a result of injury, trauma, or life stage. We know that on average, it takes women 6.5 years to seek care because, as we mentioned, these conditions have been so normalized. These symptoms range across multiple life stages and fundamentally impact the quality of life. And what we saw is that while this prevalence was so incredibly high, the access to care was incredibly limited. Less than 7% of our PTs in this country are able to serve women with pelvic floor disorders. So it's really, really hard to get care. And what happens during these disorders is people feel multiple different kinds of symptoms, whether it's pelvic pain or organ prolapse, whether it's urge incontinence. Postpartum, it's very common that the abdominal muscles are separated. They've been stretched and you've given birth, and that creates all sorts of pain and dysfunction. And pelvic floor physical therapy does a really good job very quickly to help strengthen those abdominal muscles. So that's what we're doing. We're offering digital physical therapy for women as soon as next day to really address the root causes of these pelvic floor disorders through the app via video visit with your pelvic floor physical therapist. And they will do an assessment around your movement, your breathing, your history through the Hinge Health app. If someone needs in-person care, we can help them navigate through care coordination, someone that they could see. We as Hinge Health are only providing the care virtually. So we see women at all ages impacted by these conditions. So it's not been addressed because there's a lot of stigma. It's really hard to talk about urinary incontinence or painful intercourse. Like, these topics haven't been addressed in the mainstream. That's one side of things. Secondly, is that there hasn't been much research in this area. It's only been less than 30 years, and we've been required to do clinical studies on women. So this area hasn't been focused on effectively. And then at the same time, there is a real lack of access because it's a self-fulfilling prophecy. When we talk to physicians, they say, well, yes, these issues come up, but we have no one to refer to, so then we don't address these issues. And it becomes a cycle of lack of access, stigma, and the issues being unaddressed and unaddressed time and time again. That's what has to stop. In France, postpartum pelvic floor physical therapy is the norm. Every woman gets 10 pelvic floor physical therapist visits covered postpartum. This is the fundamental standard of care. In this country, not the case.
And if you feel like you are having a pelvic floor disorder, make sure that you check with your healthcare provider.